Hi, I'm Keiser, your state senator from the 33rd Legislative District and chair of the Senate Health and Long-Term Care Committee. We're in the opening week of what is expected to be a challenging legislative session. We have only 60 days to tackle the serious problems we face, such as potential cuts in lifeline programs such as health care for low-income adults and children. Roughly 40% of the residents in our local communities in the 33rd Legislative District depend on some kind of state service to survive. That's nearly 50,000 people, probably someone in your neighborhood or even in your family. Most of us need medical or economic support, programs that are now in jeopardy because of the $2.6 billion economic budget shortfall. The governor's initial budget called for the elimination of the basic health program, which provides health care coverage for almost 65,000 individuals and has nearly 90,000 people on its waiting list. That initial budget also called for the elimination of the general assistance program for approximately 20,000 mentally and physically disabled people, and also cut health care coverage for 16,000 low-income children. Now, the governor has since released her so-called Book 2 budget, which restores 2 of those vital health programs. And hopefully we will make progress on health care reform at the federal level, and with federal action we may be able to get the funding we need to maintain the basic health plan and the general assistance program for those who are mentally or physically unable to work. But there's still much work ahead. I recently signed a letter along with the governor and other legislative leaders to all the members of the Washington congressional delegation asking that 5 provisions be added to the final federal health reform bill that will help us save health services for tens of thousands of Washingtonians, including giving the states a waiver to expand our Medicaid programs early to childless adults starting this year. That will allow the state to meet federal requirements of a federal Medicaid waiver and continue our basic health and general assistance medical programs. We also ask Congress to retain the Children's Health Insurance Program beyond 2013 so we can preserve the Apple Health for Kids program that is so successful in preventing childhood illnesses from becoming chronic conditions. There is reason to hope, but let me be clear, cuts to other health services are a very real threat. Many people are surprised to learn that last year we already made $3.3 billion in program cuts. Most people never even heard about those reductions. But it does mean that there's much less flexibility in the budget this year. With federal requirements and constitutional mandates, we have only 30% of our budget available to bear the entire brunt of the $2.6 billion cut. It is clear we no longer have big enough cuts that we can make to make up the shortfall without causing lasting damages to our communities and families. Now, economic hardships seem to be affecting just about everyone. And in our neighborhood, the Green River Valley and the businesses there are no exception. Adding to the problems of the economy is the flood threat brought on by problems of the Howard Hansen Dam and the surrounding levees. It is staggering to think about the economic losses that could result from the failure of the dam or one of the levees. The 2009 assessed value of the buildings in the Kent Valley along the levees is $3.9 billion. The annual gross business income in the region is $8 billion. Unfortunately, many of the businesses cannot find affordable, available supplemental flood insurance. So I am sponsoring legislation to give the insurance commissioner the authority to create what's called a joint underwriting association. The insurance commissioner would assess risks and set premiums for the businesses that choose to purchase the insurance with a maximum cap on coverage. My bill is Senate Bill 6240. We had an important hearing on it just this last week in committee. This is a good approach, and I look forward to working with my colleagues in the House to get this bill passed. Now, of course, if you live in the Green River Valley, I strongly recommend that you immediately purchase flood insurance from the federal flood insurance program. It's a low-cost subsidized program by the government, and the website is www.floodsmart.gov. Now, on the topic of health, We're hearing that Congress will soon pass federal health reform, and let me tell you a few of the pieces of this massive legislation that has been overlooked in much of the debate. For example, if this bill passes, we will see a substantial increase in our community and rural health clinics. I believe the legislation provides funding for an additional 10,000 clinics, serving an additional 25 million Americans. You know, we have one of these clinics in Kent and another one in SeaTac. These are vital parts of our safety net. Now, the bills also provide generous tax credits to small businesses that provide health insurance for their employees beginning this year in the Senate version. And in larger businesses that provide health benefits for retirees, there's new federal reinsurance that will cut the cost to employers and encourage the maintenance of retiree health benefits. For employees who have been laid off, the legislation will allow the extension of COBRA coverage through 2013 instead of the current limited number of months now allowed. Another key piece of this health reform legislation that hasn't received enough attention yet is the low-cost student loans and scholarships for an additional 20,000 primary care doctors, nurses, and physician assistants through our National Health Services Corps. So once this legislation is fully in effect, 30 million more Americans will have affordable health care, and we will have achieved health care coverage for nearly 95% of all Americans. This would be a monumental accomplishment. We are working here in Olympia to establish a joint select committee on federal health reform to get our state ready to implement this massive health reform legislation. So finally, I'm working on a number of other health reform bills, and one of the most important this year is about a chemical known as BPA. It needs to be removed from baby bottles and sippy cups that are sold in our state. We have serious concerns about the danger of this chemical leaching into the bloodstream of our young children. BPA has been found to be present in more than 90% of all Americans, and in a recent test of newborns, 8 of 9 babies had BPA already in their bloodstream. I believe it's always better to be cautious about unnecessary chemical exposures, and in this case, we can remove one of those exposures if we ban the use of BPA in baby bottles and child sippy cups. Thanks for watching. I'll report again next week. Have a great week.